Here with me now is our resident physician, Dr. Corey Hebert. Dr. Hebert, certainly so scary to see what happened here. So what could be happening? What condition might he be dealing with?
Yeah, well, the first thing we need to know is that the NFL has not said exactly what has happened. Okay, so anything we say is purely speculation. However, what we're looking at is probably a syndrome called commotio cordis. And what that really is that when you look at this video, you see that he got blunt chest trauma to the left side of the chest over the heart, right? So what you see is that when that happens, the myocardium, which is the heart muscle, gets so distorted that the electrical impulses go all over the heart, which causes a ventricular fibrillation. When you have that, your heart basically stops. You need to have, obviously CPR, which was done, but you need to have your airway protected, breathing and circulation have to be protected. But the bigger issue is that with VFib, and also VTAC, it's hard to get the heart rhythms back, and without having that type of oxygen to the brain. That's what we're concerned about, because how long can that be when you don't have that type of oxygen to the brain, to the body? And that's the bigger issue here. How devastating is this?
Yeah, and we know now that he is intubated in critical condition. What does that intubation do for the body? Does it allow him to kind of heal a little bit, take some pressure off the heart?
Right. Well, see, what happens is with the heart is the organ that disseminates the oxygen throughout the body. And so if you don't have the heart working appropriately, you have to get oxygen. So we protect the airway by putting a tube down the trachea into the lungs, and then that provides the oxygen to the body, which obviously sends it to the brain. Now, the issue is that some stories are saying now that he is getting, his vitals are stable, and people are seeing that across social media. We don't know that. We do know that if you are getting medicines to make your heart beat and you're getting intubated, and that means that your vital signs would be stable, but that doesn't mean that you're doing anything on your own. So, you know, people out there right now, parents that let their children play football, everybody's very concerned about this, and we're going to be looking a lot more closely at this in the next few days, because with today, LSU, Tulane, these football games, everybody's celebrating, but this is the reality. These are gladiators out here, and we make all types of jokes about how they're not doing well and playing poorly. They're risking their lives, and this man is fighting for his life right now, and our thoughts and prayers go to his family.
Of course, we know he's young and healthy, hoping that plays a role in a quick recovery and that everything's all right.
Sure.
Dr. Corey Hebert, thank you so much for being here. We appreciate it.
Thank you.
We'll be following this story closely tonight and into tomorrow. Check back on WWLTV.com and on our social media pages for the latest.